Of course, if you're already taking patients, then you're doing all these things anyways because you're like interacting with these things in a real world scenario. But if you're like, I don't know, like 80+% of agencies that pass their accreditation survey, you might wait until you get your provider number to make sure that any patient you're treating, you will be able to bill for. And because of that, you might have like 2 to 8 months to just kind of wait. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about what you should be doing once you've passed your initial accreditation survey, but before you receive your provider number. But first, if you enjoy our content, please like, share, and subscribe. So, congratulations, you've passed your accreditation survey. Now what? Well, if you've passed your accreditation survey, that probably means you already have one of every kind of required discipline, at least one. The first thing that we advise people to do during this 2 to 8 month period between passing accreditation and receiving your provider number is start to fill up on your staff. One of the big problems with starting a home health or hospice agency is it's a big juggling act. Because home health and hospice is not care in your facility, so there's not like a constant place where people come to work, and instead it's around people's homes, you might face challenges in getting clinicians to go to various areas. And so the initial juggle of finding staff that will go to the patient and finding patients is real. It's a real big problem. You might get a referral and all of your clinicians refuse to go to this area. You might get a bunch of clinicians, no referrals in that area, and then those clinicians don't want to wait around until you maybe one day receive a referral in that area. And so what you really want to do is start just like hitting the ground running with finding as many clinical staff members as possible so that you have a general covered area. So if you get patients anywhere in your coverage area, you can staff them. This can be done in a few ways. Of course, the best case scenario is to find like 1 million direct staff members, onboard them immediately. They wait for any amount of time before you get the patient in that area. That's like in a perfect world. And they'll accept any area and any patient. So like perfect world. But that's not the real world. So there are companies that exist that are staffing companies. These staffing companies will typically have a large number of clinicians. And so if you get a patient in an area where you don't have clinical coverage for that discipline, you contract with a staffing company that does cover that area, and they can send clinicians on your behalf. A few things to keep in mind, and we will do a separate episode on how to manage staffing companies, but there's some rules around this. So like, for example, every clinician from the staffing company still needs to be oriented to your rules. Like all of the rules that apply to your direct staff members still apply to the staffing company staff. But it is still a great resource of like, a bunch of clinicians that you wouldn't have access to normally. So if there are staffing companies in your area, you want to start really asking around for that stuff. How do you do this? You ask every clinician you ever meet, anyone in the industry, what are good staffing companies? Typically, the staffing companies will staff therapy services only, sometimes also with social work. It's rare to get like nursing staffing companies, but they do exist. The best case scenario is still to have staff that are directly employed by you and not through a middleman. But in times of like, you need coverage and whatever, the staffing companies are a great option. But of course, go and try to find actual like direct clinicians. You do this by just asking around. You do this by networking in industry events. In these few months between passing the survey and getting your provider number, if you're not planning on actually accepting patients in this time frame, some agencies do accept patients during this time and then bill for it once they have the provider number. If you're not taking that route, you want to just network as much as possible to fill your roster. The more people you can onboard in this amount of time, the better. But sometimes clinicians don't want to onboard for nothing. They want to wait for there to be a referral, or at least like the idea that you're receiving referrals in that area to sign up with you, because it's a whole process to sign up, right? You have to orient them. There's competencies. It's like all this stuff. So, and you have to in-service them regularly, blah, blah, blah. So at the very least, you want to get a list of people, their general areas, the services or clinical services that they can provide and are willing to provide. Able, as we know in healthcare, able and willing are different things. And you really want to fill that roster with every kind of discipline. So like a bunch of nurses, a bunch of therapists, a bunch of aides, and so on. Even if those people ultimately don't end up signing up with you, they might have other referrals once you have specific, area requirements. At the same time, the other part of the juggle is the referral part. It's a little bit difficult to market in this time frame unless you already have kind of a referral source, and unless you're already accepting patients. A lot of people just don't accept patients in this period because they can't bill for them. And because they can't bill for them, they can't mark their place in the system so that other agencies can't steal them, whatever, also provide services and bill. If you're not taking patients in this time period, marketing to doctors all day long and hospitals and all this stuff gets a little tricky. It's tricky because you're both brand new, so there's like a trust aspect here, and you're also not taking. So like, they're going to feel like, why are you wasting my time? The flip of this is when you do start accepting patients and you're like actively marketing, most referrals that you're going to get are going to be like the referrals that nobody else wants to take. They're going to be too far or difficult patients or clinically super complex and like things that other people don't do, just like whatever encompasses something that another agency wouldn't accept, right? And so that's why you want to be prepared, especially with staff in like random and kind of remote areas of your GSA, geographical service area, so that when you do start getting referrals from your referral sources and they do give you these like really out of the way patients or, whatever, that you have at least a hope of staff to cover it. So this staff referral juggling becomes much easier if the staff part is somewhat covered. This is one of the biggest things that you can do. You probably also have your top management staff, administrator, director of patient care services, and their designees. In this time frame, these staff members have to either understand that they're going to have to increase their hours for your company, right? Like, because when you're going through the initial accreditation process, unless you're already active, like let's say you're like taking kind of private pay patients or whatever, you're already, performing services, the administrator, DPCS, and especially the designees are probably not like full-time in your company because there's just nothing to do full-time when you have 5 or 10 patients. So this moment is when you start to really establish like their transition into more hours in your company. If you don't start talking about this in this time period, you're going to be really caught off guard when you start taking active patients, like a lot of patients, and let's say they're just not available as much as you need them. This actually happens sometimes. So you really want to have this outline, because a lot of times the DPCS or the administrator will have, obviously they're going to have other jobs. Like they have to make a living somewhere, right? So either they need to up their hours or you need to find somebody else or whatever. I don't know. But just keep in mind that this issue can come up. You're also probably going to need at least one office staff member. You don't need to hire them before you get the provider number, but you should start looking for that person. And in a best case scenario, like ideal world, you can start training that person. Like, let's say if you find somebody that's like, you think is perfect, you're going to vibe together, you're going to work well together. You want to start at least little by little training that person for the position, even before things start. This ensures that once you get that patient, they know exactly what they're doing and you're not fumbling with a referral source who's like trying you out. You just have more chance of success with referral sources if you take care of the first patients they send you perfectly. And that's almost impossible if you're also like looking for staff and looking for field staff and, doing all the setup activities, and like your, DO and administrator aren't as involved as you thought they would be, or you did expect them to be as involved as you need them to be. So these are all kind of like considerations you want to think about in these couple of months, in these few months between accreditation passing and provider number receipt. A few other things you might want to consider are, what's your accounting software going to be? A lot of times people, will not consider things like accounting softwares and things like that, but it's very hard to run a business effectively if you don't have this like detailed financial stuff like buttoned down. And the best way to lose field staff, which are already hard to find, is to pay them late because you mismanage the finances. Like, number one way. Field staff are really high in demand and they're just not going to mess with a company that's not paying them on time. And they're right, as they should. It's hard to do home health visits. And if you think about it, like, I go into an office every day, right? Like I go into my office, I have my desk, I sit down, I can make my coffee whenever I want. I can go to the bathroom if I want. They don't have those luxuries. Their office is their car. And if they need to use a restroom, they have to stop at like a Starbucks and then they're late for their next appointment. Like it's hard to be a field staff. And so every patient they walk into could be nice, could be mean, could be what, who knows what they're walking into, right? Like in the house. And so the best way to retain your field staff is just to make like that process is difficult. You want to make everything around that process easy. So get your accounting software, make sure you're like very honed in on your finances to always have payroll on time, especially as you're starting out and you're like, kind of maybe fumbling through like, oh, I accepted the patient. I have to pay my staff 2 weeks later, but I'm not going to get paid for like 30 days, 45 days, or 60 days, depending on when I bill, when I get my stuff together to bill, and then it takes a couple of weeks to get the billing payment back. So you have to have that in mind. And that's the point of the capitalization process with your MAC initially, is so they make sure that you have some kind of funding available to pay the field staff to do all this, so that you're not like abandoning your patients if they quit, like if you're not paying them. So really like keep an eye out on your finances, and the best way to do that is through like QuickBooks or, whatever accounting software. In that same breath, and this is an obvious one, that's why I didn't put it first, but start really looking for your management software for your office. Chances are you're maybe using it already if you've like passed your survey with the 5 or 10 patients. So you want to look at, do I like this software? Where were did we run into issues with the software? Were there compliance issues with the software? If you liked it, great. Keep it, keep going, blah, blah, blah. if you didn't like it, this is the chance. This is like the moment to switch out. This is the moment to cancel that contract, get to the new one, whatever. You also want to consider who is going to be your like billing connection provider. One of the things that people don't really think about is like you get your software, but you also need a company like Ability or something like that where they're like your VPN to bill. So look for that. There's going to be rate differences with that. So like, they charge differently, the different companies. There's some companies that could be free, but they're like annoying to use. So you really want to pros and cons this for yourself. It's going to be an individual decision. You also want to find, if you don't already have this, somebody to ask questions from. That could be a consultant. That could be your best friend who's done this for like 20 years. It doesn't matter. If you have people that you can ask questions to and stuff like that, great. During the initial survey process, you're looking at 5 patients for hospice and 10 patients for home health. You're probably taking on easier patients. You're probably not taking like the most clinically complex patients. Once you are more active and working, there might be situations that you don't know how to deal with, and you want to make sure that you, your administrator, your DPCS, they all have somewhere to ask if there's like something that comes up that they don't know how to deal with. This is also a really good time to get super familiar with the various regulations. Even though you have just passed survey, you want to really like, any deficiencies that you had, really think about how you're going to incorporate this into your processes and, stuff like that. You also want to identify and find your vendors. So who's your biller going to be? Are you going to bill in-house? Are you going to get a vendor? We definitely recommend to start, unless you already know how to do all this stuff, you want to start out with professional vendors because the initial setup process of billing has some nuances to it. When you're providing care, when you're doing all this stuff, as you start to get more and more patients, that becomes a coordination effort. So you want to be able to put your full focus on that stuff and keep these more technical aspects, not like at vendor level. You don't have to do that forever, but to have people lined up, even if you want to do it in-house, right? Like to have a backup vendor in case like you try and it's just not working, or like, you keep hitting this wall or that wall or whatever. You want to have all these like vendor pieces lined up so that if you did want to do stuff in-house, like, and those things broke down for whatever reason, that you have a plan B. There are a lot of vendor companies for home health and hospice, especially in areas that have a lot of home health and hospices. If you are in a more rural area, in a state that is like, there's one company per county, this kind of place, you probably don't have these like very intensive networks, vendors network structures in your area. So you want to look in places like Los Angeles, like California. California typically just has a lot of vendor structures here. Florida will have a lot of like just like a lot of vendor networks and things like that. Texas has a lot of vendor networks. So if you can't find, of course, you always want to start with local vendors if you can. But if you can't find local vendors, then look in places that have a lot of home health and hospice agencies, because there's just going to be a whole vendor network and a whole structure around it. Some vendors for the industry include billers, coders, people that can help put together care plans and things like that, or that can teach you how to do care planning stuff in more complex situations. You want to find people who are versed in ADRs in case you encounter ADRs and things like that. Especially now in hospice, CMS potentially puts hospice agencies on an ADR structure initially just to make sure that the care is going well. There's some of that going on. So you really want to establish all of these like kind of like vendors. This is really like get your Rolodex filled up. And if you're too young to know what a Rolodex is, get your contacts list filled up with as many support structures as possible so that anything that like happens, even if you don't know what to do, you can ask somebody. Another important vendor to consider and start looking for, especially if you get your provider number towards the beginning of the year, is your cost report preparer. This can be an accountant or sometimes not, depending on what the situation is, but it shouldn't be a random accountant that has never touched this before, because you're just going to get like overcharged. They might not do it right and things like that. There are plenty of people who specialize in cost report preparation for Medicare. Find them. They're going to have the most competitive pricing for this stuff. And maybe we're a little bit biased, but figure out how you're going to maintain your administrative compliance long term. This could be through a consulting company. This could be through like a framework kind of situation like ours. This could be your administrator is going to be full-time in doing that. Great. This could be a software situation. We have a video about like the various ways you can approach compliance. Of course, we recommend the framework because that's just like what we do. And we feel that that's the best approach to this situation. But of course, the decision is an individualized decision. But you do really want to maintain the compliance that you have already established with your 5 or 10 patients and all the activities. Once you're active, people get very busy in the day-to-day of like patient care and things like that. And so it's harder for them to maintain all these processes. Of course, the best case scenario is that you have your in-house staff, your administrator, DPCS, they're all full-time, blah, 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 and they're just like doing all these things, the exact time points and maintaining the compliance that you already established during your survey process. Unfortunately, life doesn't always work out that way. And so at the very least, you want to have these other approaches to compliance available as backups in case this doesn't go according to plan for you. Especially because agencies that are just starting out might not have the resources to employ these expensive positions on a full-time basis. And they might not need to. You might be at a 10 patient census for like 6 months. 10 patients isn't enough to pay the rent and pay for like two $10,000 a month positions, separate positions either. So, or, whatever it is that you pay those people. And so you really want to have all of this kind of in your mind up front. And probably the last point is, if you initially started out with like a tiny office just to take you through this accreditation period, because like it sits empty, especially in California, like the first year plus, it's just sitting empty while we're going through the registration application processes with California Health Department, Medicare, all this stuff, right? Before you get your license, before you get any patients, it's just like an empty office. You want to start like really thinking about and looking out for like what kind of office space am I going to need? Am I going to need to grow into and things like that? You might not need to think about this for like a year in advance, right? Or it might come up like 3 months later. So you want to make sure that you have really thought about these things and that you do it in time and not when it's too late. Now you have like 5 people sitting in 2 rooms and everyone's like getting in each other's way. That's pretty much it. It's not like a giant list, but this is the best things that you can do in the months that you're just waiting for your provider number. Of course, if you're already taking patients, then you're doing all these things anyways because you're like interacting with these things in a real world scenario. But if you're like, like 80+% of agencies that pass their accreditation survey, you might wait until you get your provider number to make sure that any patient you're treating, you will be able to bill for. And because of that, you might have like 2 to 8 months to just kind of wait. Taking these steps in those 2 to 8 months is truly going to be the difference of starting off in a successful way in your business or not. So we highly encourage you to take the various steps. Find as much direct staff as possible in terms of clinical staff of all disciplines. Find whatever staffing companies you can find in your area if those exist. Consider an accounting software if you don't already have one in place. Consider and really evaluate if you've liked the process of your home health or hospice software. If not, this is a great time to start looking around, especially since you've gotten experience now with one. You will know what to look for and not in other softwares. Talk to your director of patient care services, administrator, and any designees about increasing their hours with the need of the agency. And if they won't be able to be there as much as you need, consider switching them out, because especially if you're like inexperienced in the industry, like not totally, but if you're not like this is your fifth agency that you're starting or whatever, you will have situations that you're really going to need that staff and their expertise. So like if they won't be able to devote the appropriate amount of time, it's going to be problematic for you. And did you like working with them? Because if not, maybe you just want to switch them out anyways. Like if everything was like a hassle, like just follow up, things like that. Looking for, if you don't already have the office staff that will be working in your office, and if you can in advance start really like orienting and training those people on their positions and on the rules of the industry. They don't have to know how to like put together an admission package and whatever their role is, but they should know the important rules of the industry, especially as it relates to their role. Finding any kind of like consultant, any other like professionals in the space, joining any kind of like local networking groups for this industry, so that if any problem arises, you have somebody to ask. And figuring out the processes and the frameworks you might need to incorporate to maintain continuous compliance. Because once you get busy, unless you have really established processes, that stuff is the first thing to, just keep getting put on the back burner. Like if you're busy trying to do patient care, you're not going to be like thinking about administrative tasks and stuff like that. Making sure you have a plan for that initial period between taking patients and having to pay staff and actually getting paid. So there's like anywhere from like 45 to like 65 days there. And lastly, lining up all your vendors, like whatever it is you're going to need. As a hospice, you might need like medical transportation, non-medical transportation, pharmacies, whatever, whatever the vendors are. So just having like the vendors and the backup vendors, just in case, so that if anything, you have somewhere to ask, you have somewhere to go and things like that. So this is what you can do in those 2 to 8 months prior to receiving your provider number to really hit the ground running and get off on the right foot. So again, my name is Mariam Treystman from the Home Health Consultant. And I passed my survey, now what? And if you enjoy our content, please like, subscribe, and share. Thank you.